So we're going to do balanced ligamentous tension of the thoracic outlet. I think there was a little confusion in lab. The motions again around the axes is the treatment. So it's sort of a diagnosis and treatment all at the same time. You've already figured out that there's a thoracic outlet problem, or there's some lymphatic issue in the head, or you just have a guess. So first thing I'm going to do is squash her shoulders down. She's going to rotate right, left. This little wiggle dance, right? We're rotating around an AP axis. She'll go to the left. She doesn't really go to the right. So we put her to what she likes to do, the ease. So we're going to wiggle her left. Now I'm going to take my hands and do a steering wheel motion around a vertical axis. So the right shoulder's coming off the table, the left shoulder's coming off the table. She likes left better. Now on top of that, I'm going to add the motorcycle starting motion or the towel wringing motion. And we're going to try to twist her right shoulder towards her feet and her left shoulder towards her feet. And her left shoulder will go towards her feet. So I've now stacked all three motions that her body will let me do, and I'm going to hold her here for a little while. Until it releases.
I think generally about a minute, but it varies.
I would say I'm going to hang out for about 90 seconds. Magic 90 seconds, okay? And then I'm like, oh, she's so much better, and I've cleared her thoracic outlet. We're going to do balanced ligamentous tension of the diaphragm. So you should take your hands and put them on the side of the patient's body, really. My index fingers are about rib 10-ish, rib 9-ish. And so I'm really just making sure that the squishy part of the side, that's what I'm holding on to. And I'm rotating her body towards me. I'm grabbing her right side, lifting it off the table and turning it towards me. Okay, now I'm going to do the opposite. That's a lot harder.
That hurts, yeah.
She didn't get any heavier. It's just a lot harder to move. Okay? So now I'm going to turn her to the direction she'll let me by taking her right side off the table. And we're just going to hold it. And that was my self. Okay? And we hold it here for 90 seconds. Now what this lets me know, theoretically, if it's her diaphragm that's the problem, is that T12 is rotated to the left. And if I think about side bending, it feels like she's side bent left. Balanced ligamentous tension of the hip. You need to locate the greater trochanter. So we think about your hips a lot of times as like being your pelvis, but way farther down. If it's a girl, it's kind of where her curvature is, or her saddlebag would be. So here we go, greater trochanter. Hip, 4.5 inches later, greater trochanter. Okay. So now my fingers are there, my hand, my meaty part, thenar eminence, is going to push down towards the table. Okay. If it's restricted in this motion, it does not like to externally rotate, and it is stuck in internal rotation. Now I have to find the opposite side, which means you're going to stick your hand on like the bottom of her buttock, right? And now I'm going to pull the trochanter towards me, or up, really, up away from the table. If it resists that motion, it is stuck in external rotation. Okay.
Hey guys, we're going to be doing effleurage for the HENT system. So doing effleurage, that's working on the sinuses, okay? So we're going to need an indication to do that. So you could percuss the sinuses and ask them, is that tender? And if they said yes, that could be a good indication. You could just palpate along and see if there's any tissue texture changes, if there's any sort of bogginess, or if it's very warm or it's erythematous to look at. So if you get those indications, then you would start off at her frontal sinus and just do sort of a firm pressure, and then go down around the frontal bone, follow down in front of the ear, so the preauricular nodes, and then follow down sort of along the SCM is how I do it, but that's where the cervical nodes are. Then you would come around her maxillary sinuses and then do the same thing, come up to the ear and then follow it down. And it feels really nice. Most patients are like, keep going. And then you'll do up here by the chin and come up back to the ear and then follow it on down. And that's effleurage. Is there anything I missed with that? Muscle energy of the jaw now. So basically if someone comes in complaining of jaw pain, or you know they have TMJ syndrome, or you just see that the jaw is literally deviated, that would be an instance that you could try that. So one way to tell is to have them open their jaw while you're on the TMJ joint. So can you open your mouth for me? Good. And you would feel for where the click is, but she doesn't have TMJ syndrome, so I don't feel a click. Next, you would say, okay, can you open your jaw for me? And you would see if there's any sort of deviation, okay? And I don't really see, hers might deviate slightly to the left. And then can you open your jaw for me one more time? And then another way to check if you don't see a deviation is just to move it around yourself, and it feels like that's a little bit easier to her left. So what I would do is I would say, okay, can you open your jaw for me? And then I would put her into her barrier, which is translating to the right. And I'd say, okay, can you push your jaw back against me, against my finger? Good, relax. And then I'm going to move it a little bit more. Okay, push against me. And it feels a little weird for the patient, but just tell them it'll be over soon. And then one more time, can you push back against me? Relax. And so if they had an issue, so can you open your jaw for me? Usually you're supposed to be able to fit 3 fingers within your mouth like that. That's normal. But if they can't, another way you could do muscle energy is just to literally hold open their mouth and then say, okay, can you push up against me? Okay, relax. And then just match my force, okay? Push up against me, relax. And then, one more time, bring her up. And then you would, check for effectiveness. So that's muscle energy of the jaw. Okay. So people with TMJ can have trouble opening their mouth, or they can have trouble closing their mouth. So this is the treatment for if they have trouble closing their mouth and have pain, and that can be due to a lateral pterygoid muscle problem. So I would have her, close her mouth, and I would say, okay, push down against me, against my fingers. Okay, relax. And I'm kind of like choking her right now, so I'm going to switch my hands. Okay, and then can you push down against me? Okay, relax. And I'll bring her back up, push down against me. And you can't really get to a true barrier because her teeth, are there, but close as much as you can. And then push down against me. Okay, relax. And then you would rescreen after that.
So guys, the Bob Ross Chapman's experience. Now, when we start out, we're going to start out with the HENT because that's a little bit more difficult for some people. So, and we're just going to start up at the very tippy top with that middle ear. Now, when I find the middle ear, I'm going to go right over here about to the mid-clavicular line, and I'm just going to go right up on that clavicle and sit right there. Okay? Now, because we found that point, we can actually just come to just below the clavicle, put our nasal sinuses in, right there. Now, if we go just down here to about on the second rib, we'll just put our regular sinuses right there, because think about it. Your sinuses kind of stack up on top of each other. They're in a straight line down, and look, this makes a straight line down from the ear. Now that we've got those 3 points out of the way, we're just going to come over here and we're just going to get our pharynx. Now, if you remember this, the pharynx is actually right here where the clavicle, just below where the clavicle meets the manubrium of the sternum. We're just going to put a happy little Chapman's point right there. Now then, from there, you can see that we've got a little piece of the first rib right here. And about where that first rib meets that manubrium, that's where you're going to find the tonsils. Okay? Now that we have the tonsils, we've got one more of the major HENT points, and that's going to be the tongue. Now the tongue sits directly on a rib, so it's right here on rib 2, right where it comes here at the sternal, right here where it attaches to the sternum. There we go, that's what I was saying. So we've got another point, and I'm starting to get twitchy and lose control of my pen, right? I can't control where it's going. Oh no. Made a mark on lovely, lovely Mr. Torso. That's okay, because we've got there are no mistakes, and we can actually turn that mistake into another happy little Chapman's point. That's the cerebellar Chapman's point. Okay? And then, of course, after we've done our HENT points, we've got the thyroid, heart, and esophagus right up here at the top in that second inner space. And then we'll continue on down through those with what I like to think of as our inner space Chapman's points. Let's go down to the third inner space right down here, right below rib 3. And that point, we're going to take a deep breath before we do this and reach out. Okay? It's just another happy little Chapman's point. So down here by rib, in the fourth inner space, we did the upper lung, so we've got the lower lobe of the lungs right here. So the lower lung is in the fourth inner space. All right? Keeping up with this. Now 5 is where we start getting tricky. So we're going to be on the right side right now. Right? So number 5 on the right is going to be a liver point. But remember, the liver is a really big organ, so it's got 2 points. So you've got 5 over here on the right and 6 on the right. That's the liver. Now that 6th joint on the right is also going to be the gallbladder. Okay? And really, if we are imagining the ribs, how they go, and they've got their costal cartilages out here, you really tend to find stuff more in the costal cartilage. But for the sake of this, we're going to say it's as close to the sternum as you can get. Okay? Now, continuing on down the right side, we've got another happy little organ down here in 7, and that is the pancreas. So pancreas is number 7 on the right. Now let's come back up and get some of these on the left. So I talked about how 5 is where we deviate. So 5 on the left is going to be your stomach acidity. Because remember, we get acid before we move it, right? We don't want to move before we get acid. So 5 on the left is the stomach acidity. 6 on the left is the stomach motility. So that's where you've acidified it, now you're turning it and moving it around. Then we're going to come down here to 7 on the left. Now number 7 on the left is going to be your spleen. Because you got to think, what's just below the stomach or what's just behind the stomach? That's the spleen. Okay, so we've made it through the stomach and we've made it through the accessory organs. Now then we're going to go down and get the small intestine, and that's going to be right here on 8, 9, and 10. And they're really kind of on these ribs. I'm trying to draw it to where I don't get into my ribs too much. So we'll come down here and we'll do 8, 9, and 10. Okay? So now that we've done those, we know our large intestine is going to be down on our IT band. Now then, since we have our little appendix point right there, we're going to come on down and do the abdominal Chapman's points. Now, you guys don't have that many abdominal Chapman's points because remember we did the small intestine and then the large intestine is actually on the leg. So, we do have this region, which I know on the pictures that you all saw in lab looks like that, right? It's a big dot right over that umbilicus. Now, the way that this really is usually they'll just have a couple of points around the umbilicus that you'll find, like this. And see, he's a happy little umbilicus. He's smiling at you. So if we go from the umbilicus and stick our finger here, and then we come over 1 inch, and then slide up 1 inch, we're going to find another point called the kidney Chapman's point. And if we go about 1 inch up from that, again, so if we're on the kidney and we go up another inch, we can actually find another point, which is just that little kidney's hat, which is the adrenal gland. And if you see, you have a little guy down here smiling at you, and he's throwing his hands up in the air, right? So that's how you can remember the bladder, which is at the bottom, then the kidneys, that's his elbows, and then his hands are the adrenal points.